The Safer at Home order has been in effect for a little over 2 months now, and that was put in place so we can be home safe and away from this virus. However, when it comes to folks like victims of domestic violence, being at home isn't really a safe place for them. And so today we want to talk about how COVID-19 has impacted domestic violence while the Safer at Home order has been in place, the city and county's response to provide support to the victims, the variety of resources that are available, including multilingual services for the Asian Pacific Islander and Latino communities. And something I think that is very important is, are there cultural differences? How does that influence reporting or help seeking? So we'll get into that when we speak with our community organizations later. And just talk about what has the county, how has the response been, and what is the state that we are in right now, and what have you seen the past couple of months?
The Domestic Violence Council is the county's Domestic Violence Coalition, as well as an office within the Department of Public Health. So countywide, really the most significant things that we've seen, we run a hotline. I put the number in the chat box, and that hotline operates by people entering a zip code and then connects to a DV agency, and it's available in numerous languages. And that really has seen a significant increase. We've had, for the first part of the year, we had about 100 to 150 calls a week. We are now averaging, the last 3 weeks, we were over 300 calls, and last week we were up to 350 calls. So we've been rising throughout COVID. The good thing about that is in domestic violence, it's really positive when people reach out for services. We would much prefer people to be reaching out and those calls going up than them being stuck at home and not being able to reach out to services. We have not seen in LA County, unlike some other jurisdictions, we have not yet seen, thankfully, an increase in homicide. Although sometimes that can take longer as the coroner sort of goes through causes of death and so forth, but we haven't seen that. And we have not seen we have seen peaks with regards to people calling law enforcement throughout COVID, but we haven't seen really a sustained significant increase in calls to law enforcement. Is what we've seen in the county and the city actually is on the positive note, is we've seen a phenomenal amount of collaboration between the city and the county, between providers and the government and so forth. We've really pulled together as a field. And I think that's something that we will carry forth even after we return to whatever normal is. And so it's been in that way, I think we've been able to provide enhanced services. We've been able to support people providing services like you'll be speaking to shortly. And it's been, in that way, I think, a very positive moment for the domestic violence field, and also, most importantly, for domestic violence survivors. So the primary resources that are available through the county are, we run this a hotline, and I posted the number 800-978-3600, which can connect people to domestic violence services throughout the county. And additionally, we have a website that's us, and on that website it's updated almost daily with ongoing resources for anything from legal services to DV agencies, hotlines, funding, and so forth. And importantly, we have a resource booklet that we put out prior to this called Reaching Out, which has also a number of resources, not only for domestic violence survivors, and I want to stress this, but for friends, family, colleagues. If you want to reach out and talk to a hotline about how you can talk to someone, how you can help someone, there's help in that resource book. And there's also resources for people who feel they may be becoming violent. And that's available also on our website. And I'm going to just read the languages. It's available in English, Spanish, Armenian, Chinese, Japanese, Korean, Tagalog, and Vietnamese for download. And really the biggest hurdle I think that we've worked to overcome with my partners on this call is, as we began the the Safer at Home, really one of the issues was survivors didn't know if services were open, or if legal services were available. And we've done a very concerted effort throughout the field, throughout the Department of Public Health and the county, to let people know that services are available. And to some degree, as Chanel will talk about, we have some expanded services available now that we didn't have prior to the pandemic.
The mayor's office, of course, has been very busy. Recently, just a few weeks ago, you guys launched Project Safe Haven, which provides housing for up to 900 families during these times. Chanel, can you go ahead and tell us about that project and how is it going right now?
Thank you so much for having us. The City of Los Angeles is really committed to making sure that people of any immigration status and of all languages have access to services. As Eve stated before, when this crisis happened, we knew that there was going to be an increase in domestic violence, and in particular, an increase in a need for shelter services. Our shelter service system has about 1,000 beds throughout the county, a little under 600 beds throughout the city. And because of the shelter-in-place mandates that have come across, the shelter system has essentially become stuck, like Eve was mentioning earlier. And so we're able to, through some donations from some pretty amazing celebrities, be able to create enough space to be able to house 900 survivors over the course of 10 weeks. We're in about week 5 of that process right now. It's called Project Safe Haven. If you or anybody that you know need access to those services, you can find a list of all of the agencies that are participating at coronavirus-la.org. They're also shared in the chat box here, the list of all of the hotline numbers. If you don't have access to internet services, you can call 211 and let them know that you are a survivor of domestic violence and that you're in need of resources, and they will be able to connect you to your local domestic violence agency. So far in week 5, we've been able to serve about 618 survivors and their families, which is over the number of shelter beds that we have in the city of Los Angeles. We also have gotten permission from our funders to be able to extend this program. So we will be extending for another 6 to 10 weeks. We want to make sure that everybody who needs services is able to access them. All of the agencies that are participating in this program have language access to a number of different languages. So if English is not your primary language, please don't let that be a barrier to keep you from reaching out from services. People can speak Spanish, they can speak several different API languages, and all of the agencies have access to language lines where they're able to access like over 170 different languages. One of the other things that the city, we've been receiving information from non-English speaking communities is around testing, and people having a fear that if they get tested or their child gets tested and one of them are positive, that they're going to be separated. So we do want to make sure that everybody knows that none of our testing sites, city or county, cross-report with DCFS. There will be, we don't cross-report with ICE. We do have isolation hotels where people can go to and be isolated so that they can be safe, but they can also stay with their children. So we have isolation hotels that can support families up to any size. So please don't let fear be a reason that you or your family is not able to be safe. In the chat box, I've also put the website for testing where you can register for a test. It's free for anybody in the county. We don't ask any questions about immigration status. That site is also coronavirus-la, and then you'll just go to the testing tab. Again, if you don't have access to internet services, you can call 311 for the city or 211 for the county, and one of the representatives will schedule a test for you over the phone so that you or your children or anybody else in your house can go ahead and get tested. The testing sites are, the information is given in English, but if English is not your primary language and you're doing this over the internet, you can put that in the notes, and the city or the county will kind of figure out how to make sure that you can get the information that you need. And 211 has also access to language lines, so somebody in your native language will be able to give all of that information. The most important thing for the city of Los Angeles is just that everybody who lives here knows that we're here to support you, that if you need resources, we're here for you, that it's our priority that you're kept safe, whether that's physically, sort of emotionally, that you have access to the testing that you or your family needs, and also that you have access to the resources that you need.
Now, the city attorney's office has also been very busy. You guys, along with the district attorney's office, launched a public safety campaign called Behind Closed Doors. Pallavi, can you talk to us about that, as well as any other outreach or training that you guys are doing?
The number of DV-related reports, we had expected to see an increase, and we weren't seeing that, and we were instead seeing a drop. And our concern was that survivors, in the wake of COVID-19, especially in those first few weeks, would not know what was still operational, what was up and running. We didn't even know. Everybody was figuring it out. It was very chaotic. Once the dust started to settle a little, we decided that we needed to explicitly reach out to the survivors. And because everything had been closed, or with the exception of certain spaces like grocery stores, pharmacies, other essential services, we knew that we would have to go to the survivors because they weren't coming to us. And so I reached out actually to Chanel with the mayor's office, and we worked together to create a flyer that targeted really the worst case scenario, the survivor who would only be able to escape for a brief moment in time in the day to go to the grocery store, or if that survivor had children. And in LA Unified School District, the LAUSD had set up grab and go meal distribution sites to distribute food to children who otherwise were not getting that regular supply because of the shutdown of schools. So we partnered with the California Grocers Association, we meaning my office, the LA City Attorney's Office, with the mayor's office, with the LA District Attorney's Office, and with LA Unified School District to distribute these flyers in grocery stores and the grab and go food sites. And the numbers on the flyer are meant to link survivors to a live person. So again, targeting that worst case scenario where maybe this is their only opportunity to get help. So we have a list of legal aid providers, shelters, which are supported by Project Safe Haven, hotlines, and also a list of resources for crime victims. Because although the courts, the criminal courts, had temporarily closed, that was only for 3 days. That when they reopened, it was at a reduced capacity. But we, meaning the LA City Attorney's Office and the LA District Attorney's Office, as the prosecutors, are still prosecuting cases. We're still filing cases. Time has been, or deadlines have been extended to hear criminal cases, but we still have resources for victims of crime, and those resources are also on the flyer. LAPD is still responding to domestic violence calls. You can call or text 911, although the text option is at this point only available in English. There are specialized domestic violence units within LAPD that are still responding to calls. And front desks are still staffed by officers who can answer the phone, even though the stations are closed to the public. The other thing I want to note is that officers will not ask about immigration status, and the immigration status of a survivor does not affect any services offered by law enforcement and by my office and the district attorney's office. So I've been working really closely with law enforcement to educate officers on the extensions of time that have been implemented by judges in order to deal with the emergency state that we are in. So a lot of my work has been putting together memos and directives to issue to law enforcement to then distribute to the officers who are on the ground dealing with calls in this current moment in time where we are, they're not really able to police normally because of social distancing requirements. And they're their policing has been impacted by the issuance of emergency rules. So we're trying to work together to ease officers into this transitional period before we resume so-called normal operations.
I wanted to talk with our community partners. I believe that one of the reasons why I wanted to invite folks like Deborah and Barbara is because domestic violence, I feel like there could be some type of cultural difference that could influence whether or not people are making reports or seeking services. So I wanted for us to talk about that. Is there a cultural difference, and does that in any way influence reporting and seeking help? So Deborah, can you talk about the Asian American communities?
When CPAF gets hotline calls, they are from recent immigrants. They may not know what their rights and resources are when they are in a DV situation. Their frame of reference may be their country of origin, and perhaps something like marital rape is not against the law, or not something that's seen as a problem that they can actually get help for. So their frame of reference may be different. So they may not be calling because they don't know they have rights that they could seek help for, and they may not know where to call. And that's where this meeting is so important. A lot of times our survivors come to us because a neighbor told them about our resources, or a school teacher told them, or a church leader or a friend from church told them about the resource that's available to them. Well, they don't have this kind of meetings. They're not seeing their neighbors anymore. They're not seeing people who can tell them about them, that CPAP exists, that they can call us for help. So I think that's the biggest challenge right now. One, they don't know that there are resources available. So it's so important that ethnic media let people know that there are resources available and that they can call, and we are open. We are absolutely open. We're open 24/7. They can call our hotline and speak in their Asian languages anytime, any day. And we are right there. And being partnered with the mayor's Project Safe Haven, we have access to resources and we can help them immediately. So it would be really fantastic if this information is pushed out more in the community.
So is there a difference when, with issues like domestic violence, is it less talked about in the Asian American communities?
Absolutely. There's definitely a level of wanting to keep it in the home and not feeling safe to talk about it. I would say that it's not talked about in the community because they think they will be blamed, or people will stigmatize them, and that this will be seen as something that's wrong in their family. And really, there's some victim blaming that is going on. So if we can, with the media, really reshape the culture of our community to understand that domestic violence happens in every socioeconomic and every community, and be able to really feel okay about addressing it in public spaces to seek help, that would be fantastic. And I think we are all part of really shifting the culture. And I just want to point out that, CPAP provides all of our services in 30 different Asian languages. You can call our hotline anytime and we will respond within 90 seconds in any Asian language. We have, aside from just the intervention services where they can come in and stay in our shelter, stay in our longer term shelter transitional program and help them establish their own permanent housing. In addition to that, we also want to work with families that want to address violence in their home together. So we have online support for families to address nonviolent parenting, we have youth programs around healthy relationships. Because
the past couple of months, have you guys received more calls?
From Asian community, we have gotten less calls. So from Asian communities, we are seeing that they're not getting the information. They're not learning about the resources available to them like they used to, through means that were available when we were open. So it would be great to get sustained outreach through media and through other means.
And I myself am Asian American, I'm a Korean American, and it's interesting because even though I speak English and I'm here living in the United States of America, I lived part of my life in Korea, and I was raised by Korean parents. I have, Korean friends and Korean relatives, but even though I may think that I'm very Americanized, in many ways I'm very Korean, I guess.
Yeah.
And the way I think is very different too, which I think that it would be the case for many Korean Americans and many Asian Americans here as well. So the more we talk about these issues, the more it's out in the media, which is why it's very important to have events like this. And the more people talk about these types of issues at the dinner table. And the more people talk about it, then the people get more access to information. So
yeah. And I'll just put one stat out. Statewide, Asians are 15% of the state population. I think it mirrors LA County and city as well. We're about 15% at every level. But if you look at services, we are only using about 3% of the resources that are being put into domestic violence. So that's something to think about. Like, we are definitely under-resourced, and people are not seeking help. So it would be great to get the information out. It's not because there's not domestic violence in the Asian community. I think it's because you're not getting help.
And let's hear about how it is in the Latino communities. Barbara.
The East Los Angeles Women's Center has existed for 45 years. We started out as a rape crisis hotline, a bilingual Spanish-English rape crisis hotline. And since then, we've evolved to include domestic violence, human trafficking, and substance abuse, and the past 4 years, housing, which has really changed the organization in significant ways. So I'll talk a little bit about really right now where we're at with this crisis. I want 3 key factors to highlight. One, that Latinos are being disappropriately hit by COVID-19. And 2, 1 in 3 Latinas will be experiencing domestic violence. And that silence is often is a part of domestic violence in the Latino community. One of our taglines is that this is where your silence is heard. So a lot of emphasis on breaking that silence. We know that within the communities, prior to this, there was a crisis, of course, especially for our immigrant families, those who are undocumented. There's been a fear under this political climate. And on top of it now, we have this other crisis. So, families and survivors are really experiencing just the stress of financial loss. And then if you add the domestic violence and COVID-19, it's unbearable. So the individuals that are coming through the Mayor's Project and our shelter and transitional housing, those who have experiencing homelessness, and those who call us, we get about 200 calls a week. And we have a chat line also, which is very popular. It wasn't before this, which is interesting, but it has really increased to around 700 to 800 chats a week. I think people feel comfortable doing this for some reason during this time. And so there has been an increased calls around domestic violence, not on sexual assault, because a lot of individuals are afraid to go into the hospital. And I think that's one of the key factors, but there has been definitely a increase on domestic violence, and specifically around homelessness and domestic violence. Saying that, it's not just that they're homeless, but there's issues of substance abuse, mental health, and really, intergenerational trauma that, they're faced with. Like, once you get into a safe place, all of this starts to unfold. And we have a team at the Mayor's Project and also at our other sites that include a housing team, so that, this is a temporary situation. And so we need to really plan what's their next step. And for the next step, it's complicated at this time, especially if you don't have an income and you don't have the family support at this time. Because sometimes, even though in the Latino community, family is the key most important thing, but many families begin to silence around this, and they may not have that connection. And with COVID-19, it's become such a stressful situation where they can't connect with their families, so then all their support systems have vanished. And many times we're the only support system for them at this point. So we try to create a team where we can address some of the mental health issues, maybe substance abuse issues, safety issues, and helping them create a path to a more permanent situation. We have, a broad spectrum from immigrant families to families who are second and third generation, and they may deal with this issue a little bit differently. But for our immigrant families, especially those have already been in crises, worried about the public charge, worried about if they are going to be deported, this type of crisis, and now we have this situation now, there needs to be a lot of support. One of our models that we use is a promotora model. These are women who are trained in the community to reach out to their neighbors, to their local schools, and they are the bridge to our organization because they build that trust. The key factor here is trust. At this point, there's so many individuals in our communities that just don't trust. They don't trust the police, they don't trust the sheriff's department, they don't trust the hospitals, so they isolate themselves. So you need to be able to make that connection. So our community members reaching out to each other. Deborah talked about putting a flyer out. It's that personal connection that someone will think and reflect and make that call. This crisis was prior to this. This is not something new here, and addressing all of these issues, so we need to work closely with our legal, the legal field and the housing field, and everyone, in order to address the issues so that all of our families have a safe path to a permanent home and to a safe home.
And you mentioned trust a while ago, and I think that goes for a lot of communities out there, because I know, that in many communities, they would probably trust their community-based organization or even their media and their language more than any government offices. So it's important to do a lot of outreach and have conversations like this.
I think that it happens in every socioeconomic family. There are studies, though, that show that during a crisis, domestic violence goes up. So it went up when there was a crisis in the Gulf, Katrina. It goes up when there are crises, because it's not like domestic violence will happen in a household that never had violence, but if there is violence, has been in the household, it escalates, it becomes worse. So definitely there's domestic violence in every socioeconomic group. Now, I would say this particular crisis has been more troublesome for Asian American community, partly because before the Safer at Home order came into effect, a lot of Asian businesses lost their income. A lot of Asian businesses were showing loss of up to 80% of their revenue before we had the shutdown. So there was a lot of stressors, and there were a lot of survivors who were calling us saying they lost their jobs, and so they were more financially insecure. Our survivors who graduated our programs were calling us saying that they lost their jobs and needed help. So definitely it exacerbated the problem. And also the other thing that we're hearing is there's hate crime that are increasing towards Asian Americans, especially Chinese community. There is, so it feels like they're not safe at home and they're not safe going out. So definitely the stressors for Asian survivors have been going way up.
Within our Latino community, immigrant families who work, street vendors and have worked, as janitors and, working in these areas, and now have no income and have no access to unemployment. The stimulus check, there are some funds that came out this week, but I think they're already tapped out. So, this is a huge issue around, immigrant families who have no access to resources.
So I just also want to be able to say that socioeconomic status is not a factor in domestic violence. Domestic violence happens across all socioeconomic factors, as Deborah said earlier. I do want to make sure that it's very clear that this pandemic did not cause anybody to be violent, that it increases violence and because people don't have kind of a means to their normal coping mechanisms, and also obviously there's an increased level of stress, but violence was in these relationships, or some sort of power and control were in these relationships prior to the pandemic. So people who have a tendency to behave violently in their relationship sometimes have coping mechanisms where maybe they're able to go for a walk, or they're able to work out, or they can go hang out with their friends, they can take space from each other and go to a family member's house, and all of those things are limited because of the stay-at-home orders, which increases the level of violence because people don't have access to their regular coping mechanisms. However, not having access to your coping mechanisms does not cause someone who was not ordinarily violent or who was not ordinarily utilizing other tactics of power and control in their relationship to suddenly become violent. So I think it is important that all of us remember that while times of crisis levels of violence increase, that is not a justification for people to become violent.
For a survivor and this is probably true of anyone who experiences any form of trauma, that to not expect to make decisions during that moment of crisis. So for instance, a survivor who is worried about the next act of abuse, we recommend that that person formulate a safety plan so that that plan can be relied upon if and when the abuse happens again. We have been also telling people, because of the restrictions on outside activities, to as much as they can sort of find a safe space inside their home, to the extent that it is possible, to sort of to separate from the abuser. Now, these are tactics that are meant to buy time until help arrives.
The other thing is people could maybe reach out to neighbors or friends or relatives to let them know what's going on, and they may be able to access resources. I do want to emphasize that those people can call hotlines also to find out what's the best way they can help their neighbors or their friends or their relatives. So if someone is in touch with anyone, someone they know from their religious organization or anything like that, maybe they can let that person know, and that could be a pathway for them for safety. And additionally, if they can get to a hotline, most service providers, as both Deborah and Barbara said, can help people develop these safety plans, whether or not they are ready to leave their home. It's very important to underscore that you can have DV services regardless of what you want to do. If you want to stay, if you want to go, if you're somewhere in between, if you want to talk to someone about it, the people who are answering the hotlines are trained and care and can have those conversations to help survivors decide. So it doesn't have to be a major decision just to reach out either to a neighbor or to a hotline. It could just be that first time that somebody wants to talk, and it's confidential and it's available 24/7, and that can help them move forward, whether it be that day, whether it be a month from now, or whatever. So everybody's slightly different, but the resources are there all the time.
There was a study done by Chris Sullivan, and she showed that just knowing what resources are available makes a survivor of domestic violence 25% safer. So just knowing where there's help, what community resources are available, is that powerful. CPAF's website has various language, various safety planning in various Asian languages, so they can just browse through that to figure out what are some things they could do.
Also so important for those who are maybe even not going through any type of domestic violence, but just to stay vigilant, to see how others are, and especially because nowadays everyone's wearing a mask and they're all covered up. So even another reason why people should be more vigilant, and if they see any signs of abuse, to go ahead and make that report for someone, because you could eventually, end up saving someone's life. Thank you so much for joining in on this very important conversation. We'll be hosting more ethnic media roundtables on very important issues like this. So I hope you can continue to cover and help us just reach out to all those communities with all of this important information.